Hello, everybody. This is Lisa Johnson from Everbridge. Thank you so much for joining us for today's webinar. We will be presenting a FEMA Pro Talks Emergency Preparedness with Joe Martino. We're going to review the agenda and then talk a little bit of logistics, and then I'll introduce Joe and we can begin the presentation. We are going to, besides covering logistics and introductions, we'll have an overview of Northwell Health. We will also have an overview of COOP and what that entails. There'll be considerations that you need to think about during an emergency, such as situational awareness, creativity during an incident, and dispelling the fear of information. We'll have some technology insights about what is working today, and we'll talk about privacy concerns as well. At any time, if you'd like to get more information from us, we do have a Twitter account which is specifically for healthcare organizations, and you can follow us at EB Healthcare. Okay, I'd like to introduce our speaker, Joe Martino. Joe is one of the emergency management coordinators for Northwell Health. He's been working there for the past 7 years. He is also a master instructor for FEMA at the Center for Domestic Preparedness, where he specializes in healthcare emergency preparedness. Previously, he worked as an EMS dispatcher in the Command and Control Center for Northwell Health, and he's also trained as a paramedic. Thank you so much, Joe, for coming today.
You're welcome, Lisa. Thank you. If you can just let me show my screen. Good afternoon, everyone. Thank you for joining us. This is one of those topics that happens to keep coming up and rearing its ugly head a lot of places in healthcare specifically. And in addition to healthcare, just around the globe. Communications are in the media more and more and more every day where there's news stories. It's really impacting our daily lives to some extent. So this is one of those hot topics we like to bridge here, and we start to roll a little bit bigger with and look at how we can really manage the programs better around emergency communications, especially in the hospital realm. A little bit about me. Lisa mentioned some of it, but I walk a life mainly in emergency services. I'm a volunteer fire captain. I've been in the fire service for a better part of 12 to 14 years. Been a paramedic for a long time. Worked in communications, command and control. My function at Northwell is I handle a lot of technology on the emergency management side, whether it's the emergency management reporting software, the communication software, radio equipment that's out there, planning, all that kind of stuff falls under my umbrella, the EOC specifically. So I'm tasked on a day-to-day basis with notifying Northwell Health employees, visitors, patients, staff members, partners, what we're actually doing on a day-to-day basis as far as emergency notifications go and what the right information is to get out. In my home life, I act as an emergency manager as well. I have 3 young boys ranging from the ages of 5 to 15 months, so they can be a handful, as you'd imagine, and sometimes I wish mass notification can get them all out of the house in the morning. It's one of those challenges I look at and actually have to refer to all the time. I also am lucky enough to be teaching for the federal government. I teach down at the Center for Domestic Preparedness, several programs down there, and I get to actually meet people from cross sections of hospitals and healthcare organizations around the world actually at this point. And it's actually helped me write some of this presentation, understanding what some of their pitfalls were when I spoke to them. So I've actually been able to pull a lot of this information from my experience at FEMA as well. One of the things that, I like to talk about a lot is understanding how big Northwell is and kind of what we touch, because it explains a lot better why we do some of the things we do. And you have to kind of think about your own institution, whether it's a single hospital, a single healthcare facility, or a network of facilities, as a city to some extent. Most cities these days operate in a sense where they have to get notifications out to people, whether it's text message into this number, it's a mass email, it's a big sign on the roadway and on the highway, whatever it is, they're trying to get that information out and they're looking for tools to do it with. So we took the Northwell approach to it and said, hey, listen, we're pretty big. We're looking at 62,000 employees right now, 4 million patient contacts a year. Those numbers are actually going up. Roughly 40,000 births, 200+ thousand hospital discharges, and even ambulance transports are over 100,000 a year right now. So between that and our geographic size, we span from Westchester to Montauk with core hospitals. Those are our orange things right there that you're looking at. Those are our core facilities. On top of that, we have a bunch of affiliates that we do talk to during disasters. So we were speaking to Boca Regional during Hurricane Matthew and things like that, seeing how we could support them. We also have some strategic alliance partners that we do some transferring with and we share some resources with. We have a standalone emergency center right in Lower Manhattan across from the old St. Vincent's area. And that's one of its kind in the New York City metro area right now. It's an emergency department with nothing else attached to it. Anything that's critical gets stabilized there and transferred someplace else. It's the first of its kind in the New York metro area. We have a specific Manhattan ear and throat specialty hospital, and then we're roughly, these numbers have changed slightly, about 475 ambulatory physician practices. We have our own insurance company. It's called Care Connect, and we also partner with Hofstra to open our own medical school, which is in its third year at this point, and then we also have the a nursing school that we're opening next year. So we are really branching out, and all these people are important to us to be able to notify during disasters, during emergencies, and then also maybe gather some information from during emergencies. When you're in an area as populated as a city, Boston, New York, LA, there's tons of people seeing what's actually going on, and why not see if we can take some of their intel to make it work for us as well? And that's part of where some of this goes and the citywide approach we're looking at in emergency notification healthcare. All these things can actually feed your programs locally no matter what your size is if you're doing the right monitoring. And the good news is most of the monitoring that's in the situation around this one we'll talk about is free. So it's a nice kind of tool for us to have and make sure we can keep in our buckets. Jonathan Sachs wrote some technology stuff, and I happen to pull this quote out that he wrote because I think it's got some important information in it. And right in the middle it says, does not and cannot tell us how to use the power, when speaking about technology and communications. And it's the truth. I can give you every piece of communications equipment you can possibly get your hands on. I can get you an iPad, an iPhone, a Samsung Droid, a video camera, a webcam, laptop, tablet, whatever it is. It's still the same problem. What do we do with that technology I put in your hands? How do we make it function to the best of our ability to protect you and help us gain information without Big Brother watching, so to speak? It's a very fine line we walk. But by looking at that piece, cannot tell us how to use that power is an important piece of it, because you have to think about what's appropriate. When I'm putting out information, what's appropriate for general people? What's appropriate for the media? What's appropriate for my own staff members? How do I decide those levels of appropriateness? And that all comes with that power we're giving you with the World Wide Web, with the technology that's out there to talk to people. There needs to be some safeguards on it to make sure we have a policy that makes sense and can actually support what we're looking to do without causing hysteria, without putting out bad information, without people wondering if you're telling the truth. How do you gain the trust of somebody you've never seen when you send them an alert? And these are all concepts that we'd like to wrap our heads around here, and that, I like to talk about in this with that technology being power. When we look at who's here, and this is some of your poll questions that are out there now, and if you guys can answer some of these, it'd be helpful for us for the presentation and some follow-up. But we like to talk to people about who's responsible for COOP, Continuity of Operations Planning. Are you that person that's responsible for it? People that are responsible for Continuity of Operations Planning have a lot to do with communications, because the person that writes that plan needs to understand the idea that Continuity of Operations Planning does drive communications. We like to ask the question, are you responsible for technology? A lot of times we have people in our realms, when we've seen this locally and talking to people around the country, the people that own mass notification or emergency notification are either the emergency preparedness people that stand alone by themselves in our little microcosm, or the technology folks on the other side of the spectrum that don't tell the emergency managers what's actually available to them. And there's that break there in how that goes.
Joe, can I interrupt for just 1 second? So people are currently voting on the first question. So are you responsible for COOP? I'm going to close that poll right now and pop up the results. Everybody should be able to see the results at this point. So 56% of people are responsible for that, which is a pretty sizable chunk of our audience today. 70% of you voted, by the way, so thank you very much. And just to let you know, while you are answering these questions, I'm going to post the next one right now. Are you responsible for the technology in your hospital or healthcare system? You can vote right now. If you have questions for us at any point during the webinar, you can go to the questions tab and answer it there. We will be collecting it throughout the entire webinar. Okay, great. Oh, and we have 76% on this poll. Thank you, guys. So let me get you the answer for that one. You might be surprised. So 79% are not responsible for technology, which means you all have to negotiate with people, right, to get the stuff that you need.
And that's an important question for us, and that's one of the reasons I like to ask that. One of my jobs with communications was to bridge that gap between the technology folks and the emergency management continuity operations folks. And somebody's got to bridge that gap to make this stuff work for you. If it's not If that gap exists, it's very difficult to transition to a program that's going to be functional. So that's out there. I know Lisa just put the other question out there as well. Can one thrive without the other? It's a good question. I've seen sites where this works and technology owns it on their own, and I've seen sites where emergency management owns it on their own, works great. Most sites I've seen have a point of failure in the middle here. And that's why we like to throw that out there and say, you know, what's the story? Can they thrive without the other? Most of you said no, which is good. I think that's an important point.
Yeah, can you guys see the results as we're going? So yeah, a whopping 99%. so very strong opinions.
I'm not making this up as I go along, right? We actually are on the same page here to some extent when we know they can thrive without the other. No, it's not going to happen very well. It's going to be a challenge for us, and we want to look into that a little bit. And then my last question that's out there is, are you or your organization afraid to leverage technology? And this is one of those things that occurs in healthcare dramatically, although it's improving rapidly in the people that are willing to leverage technology. With the advent in healthcare of EMR and things like that, we're getting more into the realm of technology. Communications is always lagged a little bit behind, and most of the time it's because our employees don't want Big Brother watching. We don't allow cell phones on hospital floors and things like that. And that challenges that a little bit, but we have to really break that mold of that. Why are you afraid to leverage technology? We'll talk about some of that a little later in the presentation, of how we can leverage it better and make people really believe that it is a positive thing, not a negative thing. But I'm actually happy with the poll result on that. Most of you are not afraid to leverage technology. I like that, 76% of you. That makes me pretty happy. We've seen that kind of go either way depending on our audiences that we've spoken to, either directly or if I ask this question to a group of people, it's usually like, you know, split 50-50. I like the 76% number. Maybe the right people on the call. So a quick review of continuity operations, very basic. This is not a ConOps lecture, so to speak, but there are 4 key things that we look at when we talk about continuity operations, our 4 phases: readiness and preparedness, activation and relocation, our phase 3, which is continuity of operations, full execution, and phase 4, which is reconstitution. Those are the 4 phases of activation. But to get there, one of the keys is continuity of communications. And how do we keep that continuity? What are we doing for that? You know, under National Security Presidential Directive 51, the Homeland Security piece, and 20, so it's NSPD 51 and HSPD 20, it was really looking at primary mission essential functions, and communication has been identified as one of those, which is great for the communication technology people. We're investing that kind of backup in it, saying this does have to work. We look at specifically continuity of communications. What capability do I have? What are the functions that are out there? What do I have to do with other agencies to make that work? And will it work under all conditions? And that's one of the things you have to look at when we're looking at some of this continuity of operations stuff in our healthcare market. Will this work across borders? Most healthcare institutions have very encrypted networks. You need 4 tokens to get in, password sensitive, passwords on devices. Even if they bring your own device environment, we're putting passwords on them. How do I be able to get you to have access to the information I need you to have with all the restrictions that we need to have to protect our healthcare information? So the continuity of operations of the communications here becomes a little bit of a challenge. We're adding layers that never existed before because of all the protection standpoints. When we add layers, there's more points of failure. So how do we keep that continuity up there? And that's one of those things we have to look at with continuity and operations and communications in general. They're important concepts to think about, especially when we talk about the other piece of COOP of human capital. Our human capital, our employees, need to be notified of things. If you can't make them feel safe in the environment they're working in, are they going to keep showing up to work? If you can't notify them of that active shooter in the building, or your several campuses, if the person walks through a college campus or a medical campus with different buildings, if you can't notify the people in those facilities, do they trust you to protect them on a security side? These are all things that come up under that continuity of operations. We need our employees to be vested in this as well. And then the communications pieces really falls into readiness and preparedness. Testing and drilling through communications. Activation, does it work prior to and during an activation? Relocation, can we relocate people via notifications somehow? Sure we can. And then the full execution of continuity of operations obviously is a key concern there. Will this support our continuity of operations plan in general? And then what about getting our staff back online? One of the ideas that's been kicked around for years in circles in healthcare, at least in our area, because we are a hurricane-prone area, we're on Long Island, we're surrounded by water, there's no ifs, ands, or buts about that. One of the things we have to look at is our employees are diverse. We're spanning hundreds of miles on this island. How can I reconstitute my people? How can I reconstitute my sites? Can I use a notification or communications platform to help me do that? How can I creatively think through some of this stuff? So that's kind of where this kind of falls into the COOP plan. and how we're looking at some of those essential functions in COOP. So in the healthcare realm, I pulled together a list of some significant incidents. Obviously, there's been a lot more, but these were national significance incidents. We've had 15 years of challenge in the healthcare market. Starting with September 11, 2001, major issues in the New York City healthcare system, overran EMS, overran the hospitals pretty quickly just because of the sheer amount of volume and the fact that hospitals were in the ground zero area. It was a challenge. The Northeast blackout in 2003, hospital infrastructure as we know it was challenged. Hospitals went on generators. We found out equipment wasn't generated that should have been. All this testing that was done didn't account for a large global blackout for a long period of time. We started looking at things after the 2003 blackout like fuel for generators more closely. What if it's not a predicted event, like a hurricane when we plan on topping off our generator 96-hour sustainability? How long is this going to happen for? It also challenged outside resources. So as we grow healthcare outside of our hospital walls, as most institutions are doing now with outreach and home care and home visits and off-site visits and out-of-emergency department visits with urgent care centers, are they held to the same standards as us? Often not. What do they do during that blackout? Do we absorb their volume? How do we communicate that? How do we communicate that this incident is going on during a Northeast blackout when nothing seems to work? These are issues we had to identify and review. Hurricane Katrina in 2005, national significance down in Louisiana, down in New Orleans. Big challenge. Healthcare as we know it was demolished down in that city. And there were some pitfalls that it was definitely noted in the communications realm. They identified that as a challenge from Katrina. Any of the studies you read, after-action reports always point to the communications during the disaster and how things were communicated. Hurricanes Irene and Tornado in Joplin, the same year, we dealt with Hurricane Irene on the East Coast. They dealt with Joplin in the Midwest. And that tornado wiped out a hospital. What was their continuity operations plan? Where did the communications piece come into that? They actually did a very good job. Everything I've read pointed to very good information about the preparedness down in the Joplin area and how the hospital responded. I've seen some of the lectures for that and things like that. They did a very good job, and they leveraged some of the stuff that was there. Hurricane Irene, we did the same thing locally here in New York where information was now pouring out. We were looking at other ways of getting information. Hurricane Sandy was another challenge. You know, the mega storm, as they called it, the big storm, came up. Same challenges as Irene. We actually handled some things better and some things worse because of the size of the facility, size of the storm. We looked at some of that. The Boston bombing was another communications challenge, and I actually have some stuff highlighted then a little bit later. And then the most recent challenge to healthcare, Ebola. Right? We had all this information coming out in Ebola, and this was a nationwide, worldwide, global incident where people needed information, and we had to communicate the right information to people in a very rapid time frame. And how do we best reach our people? And then you can go on and look at what's next, right? Active shooters in hospitals. We've been pretty lucky so far. There's been some stuff that's out there. There's going to be more. Biological outbreaks. What's the next Ebola, so to speak? Or is Ebola coming back to us? And then look at what else is out there. Ransomware. Ransomware is one of those things that's becoming a big deal for us right now. Sony Pictures had their major global blackout of protected data about 2 years ago. They actually shut down their infrastructure by choice because of the ransomware attack. They were worried about what was getting out there. What about our systems during a ransomware attack? Forget about EMR for a second, which was a couple hospitals that did have to deal with this, dealt with EMR. What about our infant abduction systems, our building management systems? If you have a Pyxis system that's networked or a pump system that's networked at healthcare facilities, can that be impacted? And how do we communicate these outages or stay away from devices, things like that, to these people that we have working in our sites? So these are all challenges that have actually occurred in the last 15 years, and it's only growing. So when we look at this in general, we're looking at three things we have to consider: situational awareness, creativity, and dispelling the fear of information. When we look at situational awareness, we can only learn some lessons once. We're not going to have that second chance out there to actually please the public again or please our patients or our staff members as to what's going on. So let's look at the situational awareness concerns we have. We're looking at what we need to know, what we don't know, and what we do know. Those are the three concerns we look at, and where does it come from? What's it mean to my agency? Who's tasked with it? And what sources do we have? These are keys to identifying how we're going to manage the information flow out of our facility, into our facility, to make sure that we can stabilize an environment in a quick fashion, the best of our ability to keep people safe. We should really be embracing the idea of situational awareness. Does your local emergency planning council or committee look at situational awareness? Do you share data between entities in your locality? Do the hospitals themselves, although we compete, share information during a disaster and let people know what's going on? Those are some forms of situational awareness. Does your police department, if they're operating near or on your campus, let you know they're there? These are some of those communications that go back and forth. What sources do we have? Sources for situation awareness have become a huge challenge with the advent of social media. So in some studies and some research that we were able to figure out, we looked at situation awareness source reliability. A verified source is a great source to have, right? The police department calls you, says, we have this situation, we know exactly what it is, this is where it's going, you can trust us on this, we trust them, we know them. Then we have a trusted source. Our inner circle, so to speak, our friends that make those back-channel phone calls for us and ask us these questions. Hey, Lee, did you know this was going on? Great. I'm going to let you know what this is going on my side. Those trusted agreements we always have to keep those back channels open to make sure everybody's protected. Then we start to get down into the social media piece of this. We have our unverified sources. Somebody that's posting under the handle of the National Weather Service, but it's slightly different because they made up their own handle. People are trusting this data when they see it. It's unverified. We can't verify that source. And then we have this untrusted, unverified piece, where it's some person putting out some information out there, but once it's out there, we can't stop it from being out there, and unfortunately, people will follow and listen to this to some extent. They're going to see it and say, oh, that person's right. At Joe Martino said it's going to snow tomorrow. He's got to be right because he's looking at something I'm not. Is that the truth? Could be. It might not be. We're not sure. So how do we look at that source of information and still use it for situational awareness? Do we take it and kind of file it on the level of, hey, this could happen here? Great. That's a kind of a weather event example of it. The other example you can look at it as, and what we've used it for locally, is we had the Boston bombing at the time. We were actually following Twitter at that point in time here. And we had some other incidents locally. There was a chlorine release down south the other day. And what we started doing is we went to Twitter and put a hashtag in and started looking at images from the scene. It's untrusted and unverified because we're not there, but is it great intel for us to see what's going on? And that's where we started to make that concern of, do we need all that information to be verified? A picture is worth 1,000 words, and they're not as easy to doctor real time. 6 months from now, yes, you may see a shark floating down the streets of New York City because somebody tried to doctor a picture. Currently, that's not going to happen if it's almost immediate within a couple minutes. Is it always possible to verify the information? Chances are it's not, especially in the realm of social media and some of the sources that are coming out. There's often unverified information out there. We decide how we want to handle that in our institutions. Some situational awareness resources you can rely on: weather outlets, the National Weather Service, NOAA, your local media is usually reporting from the National Weather Service or some other function they have. Your paid intel providers, you have Breaking News Network, you have the Stringer networks, you have places like NC4s and other vendors out there that are supplying you with real-time data that you're paying for about situations near you. You have your public safety agencies. Are you in a group where you're getting public safety notifications via email, via text alert, whatever that might be? FEMA, places like that, they're sending you information now as well. Everybody's got an app that they can send you information from. Those are some great situational resources. Where's it all stemming from in the long run? People to some extent. Real-time, on-the-ground people that are feeding this information to one of these providers to begin with. Whether it's people in a think tank, whether it's people in an integration center, people with open source data that are walking down the street taking pictures, or your weather outlets with their heavily IT-based weather forecasting models and specialists, it's all stemming with people when you look at situational awareness. I'm hoping some of you folks actually monitor some of this stuff in a social media standpoint and are looking at some of this stuff on social media currently. They're great sources for situational awareness. One of the issues we have actually run into in the New York City area, and you may have all seen this at some point, is the new plan-enabled mobile device edict that came out of the government. So what ended up happening was the plan Localized alerting network came out, and they said officials are now allowed to target phones based on specific geographic cell towers. Even if you're not in that area, it's not your area code anymore, they use a cell tower to pinpoint location that can now send an emergency alert to your device that you cannot turn off. One of the problems we had locally was there was an issue in New York City, and they were asking people to take shelter now. As a hospital-based person or a healthcare-based person, can you have your employees running for shelter when they have jobs to do? Is this a misleading message for them? How could they already know what's going on before I've had time to tell them how it's going to impact them as a hospital, a healthcare institution, a patient on the street? It's kind of cutting our legs out from under us in a communications platform that we like to use to get our employees information. They know before we have a chance to tell them. It's a challenge for us in healthcare. There are tons of sources out there. All these personalized free open sources. World Health Map, great partnership between the CDC, Harvard, ProMed Mail, some European folks. It crawls the web looking for RSS feeds and looking for news articles. There's an app called Flu Near You where your employees or patients can get information about diseases real time as it's being put on the web. Is it all verified? CDC and Harvard do a good job of trying to verify some of this information, but your employees might know about the flu outbreak before you've actually decided that you want to tell them about it. It's an app for them. The government issued alerts, the warn and plan theories. Alerts issued by the president. You can actually turn those off. That's the only one they allow you to turn off. But imminent life safety and Amber Alerts cannot be turned off. And if your phones will go off, they'll vibrate, they'll make loud noises, all this other stuff. We can't do much about that. So we have to make sure our employees understand what that means for them when they're at work in a healthcare institution. And say, yes, that is an important piece of information for you. There is something going on. This is how we're going to handle it locally in our site. It's important. One of the other things I want to talk about with Twitter a little bit, that I like to use as an example, is in the center of the slide there. That was a screenshot we grabbed from Twitter. This was a text message conversation that somebody had posted, and it was a really interesting point. Can you find out what's going on with the Boston Marathon? There were just 2 explosions. What? I don't see anything. Well, something crazy definitely just happened. What do you mean by explosion? Check Twitter. People, by default now, in social groups outside of our communication strategy, are telling each other to check social media sites for this breaking information. If we're not harnessing that, using social media to our advantage and posting on social media and monitoring it, we are missing and creating a very big gap in our communication strategy because our employees are going to have more information than we do, and we have to dispel myths rather than getting in front of the myth. When we look at these concerns and these myths, what are our corporate policies on this? Do I have a no cell phone policy in a healthcare institution? I get it. We have them here locally to some extent. We've had to look at modifying them a little bit and say, hey, we kind of need our employees to have a cell phone because what if they're on their break and if they get to take the cell phone, we want to notify them about something? What if there's an emergency and they're on the site? Do we want to give them access to check their cell phone for an emergency notification, like an Amber Alert or something like that within the facility? These are important things for them to get the information on. How do we decide what the level of usage of a cell phone is in our site? The government also says we have a duty to warn people. This has been tried in several cases around the country. We have a duty to warn our staff, patients, and visitors of things that go on. Most healthcare institutions, in my experience, have done a very good job notifying their staff. Staff then usually turns around and talks to some of the patients about specific things. We're evacuating you because. There's a tornado warning because. You are aware of. We put it on the TV in front of you, whatever that is. But what about our visitors? Most people do not have good policies identifying how to communicate with their visitors during times of emergencies. It's almost an afterthought because we think about our patients and our staff first. Visitors are transient. We don't know how many or who's actually in the building, even if we have building management systems that we look at this with. So visitors are concerned, but we do have a duty to warn all these people. How do we properly do that in a rapid fashion? We have to harness the right technology to do that, whatever that technology is going to be that works for your site best. There are some hospitals that have no cell phone service in them. They don't have good infrastructure for it. So what are my other alternatives there? What are other ways we can talk to people? The other thing I wanted to address here was something called the cry-wolf hypothesis. In 1998, they came out with this hypothesis in the International Journal of Mass Emergencies and Disasters. And what it talks about is following the cancellation of a threat by a non-appearance of the predicted earthquake or other event, 46% of people surveyed did indicate that they would not pay attention the same way twice. They give less validity to that warning. So that warning becomes much more important for us because we can't send out false notifications. This is a concern, and I would never beat up the Weather Service. I partner with a lot of them. I'm very friendly with a lot of them, especially in local circles. What ended up happening the other day with the West Coast storms that were moving in, there's all this PR about this big West Coast storm coming in, Pacific Northwest, epic storm, high winds. It didn't materialize, luckily, the way they expected it to. Instead of everybody going, okay, great, we were prepared for it and warned for it, and there was no issue, there was some major blowback in social media circles and other media circles saying the Weather Service failed us. We need to have better information from the Weather Service. They did tell you something. They did get the information out, but we really have to watch what that warning is. And you can't blame anybody for that. They went with the best data they had available. But unfortunately, or fortunately, depending on how you look at it, it didn't materialize, so people aren't going to take that warning the same way twice. I could speak to my own personal experience on this one. My parents lived on the water in a nice little hamlet called Long Beach that got flooded during Hurricane Irene and Hurricane Sandy. Hurricane Irene, they evacuated. They took very minor damage to their house. Hurricane Sandy, same information. They didn't evacuate, had 8 feet of water in the house, had to be rescued 3 days later. Locally, I could speak to that and tell you exactly what that was like for a lot of people that decided not to go after the first storm the year prior. So those warnings have to be very carefully done to make sure we're not creating this quiet wolf hypothesis kind of theory and making sure that the media and everybody involved is sending out the right information in a timely fashion without scaring people or giving them a false notification. In most of the studies we've looked at, the media has actually escaped blame from a lot of this stuff. They haven't been tried. They haven't been held to court for it in general, for sensationalizing whatever the event was, which is also a challenge. So we have to look at those things when we're doing our situational awareness and decide where that's going. Locally, in our situational awareness program, we look at our intel, we evaluate it, reformat it for distribution and disseminate it from our emergency management staff to our local facilities. Their local staff then decides if they want to do an impact analysis on it and what's going to do to their services. They're going to open their command center or command system if necessary using the Hicks model. And then they'll decide locally what they want to tell their individual employees. Sitting up, quote unquote, at corporate, I can't decide the best answer for all 62,000 employees out there. The sites have to make some of that decision. So we'll push them the data they need to make that decision and then let them decide what they want to do from there. So let's talk a little bit about the creativity of this and how the creativity piece works. Creativity is interesting in communications because we can't be too creative because then something comes out wrong. It can't be duplicated. We can't get the information out at the proper time because there's too many pieces to it. So what's a simple creativity and how do we leverage some of our data? Right, so we look at backchannel communications. Backchannel communications are actually pretty dramatic. In 2007, they used it a lot for the first time in a broad scale in Southern California wildfires. And what they saw was backchannel communications were supporting the incident the right way, and the California wildfire after-action report showed that social media is gaining importance in the disaster arena, and it will be the future of disaster communications to some extent. So this is really being looked at closely in several circles. You have to look at social media, blogs, texting, peer-to-peer networks, your wikis. They're in the news all the time. What's out there on a wiki level? Right? What's our shift and acceptance? Media outlets are helping to legitimize some of this stuff. If you watch any news broadcast now, everybody's got a Twitter handle, and they're reading you things directly from Twitter or Facebook or Vine or Instagram, whatever that process is they're using. They're taking accounts from people on the ground with accounts now sending in pictures, information. This is what I saw. It's really reshaping the acceptance of how media is looking at this. They're leveraging it as well because it gives them the sensational piece they're looking for. It gives them the real-time information they're looking for when they can't get a broadcaster on site. So these are those back-channel communications that are out there. The other thing is there's this concept of information death. And we've had this happen in our healthcare institution before. We've made this mistake, and we watch institutions do it all the time. What happens is I put out an official message saying, we're going to close campuses because of a bomb threat, but then give no additional information because we're trying to keep it close-knit for intel purposes. We don't want to alarm people. So what do? They're looking for information. They turn to the Internet for it. I can Google anything and find it. Right? So I want to Google Northwell bomb threat, and then all of a sudden something happens. I want to Google Ebola outbreak. I get information on this. And our employees start turning to things that aren't verified by us to get that answer to information death. So make sure you follow up with them. Not knowing for a person that's in your facility what's going on is scary to them, especially if you make them the first alert and don't follow up on it. It's a concern. They do get nervous. They are looking for the information. We've had after-action reports coming saying, you guys did a great job of notifying us up front. What happened after that? And we really had to address our model and say we actually have to get more information out to them. It's important for them to get that information. Some of the bidirectional communication tools that you can use that are out there, TweetDeck is one of them. It's sponsored by Twitter. It's pretty good. There's also one called Hootsuite. And what they do is allow you to put different feeds up on a dashboard. You can keep it up in your office, a command center or something like that to see what's going on. Blogs are important. We follow blogs all the time. We actually have our own that we put out during disasters for our employees. The intranet. Your employee intranet can be utilized to put information out there and get information back. Doing polls on employee intranet during disasters. Talking to your employees. Mass notification systems. There's a litany of them out there. Find what works for you and make it work in this realm. And then other apps that are out there. Are there two-channel apps that we can use? Are there bidirectional apps that we can use that are freeware or that we have to pay for our sites? There's two different versions of that. Usually we have to pay for it. Your employees don't want it. And if it's free, they'll take it. It's one of those differences you have to look at. What's the best scenario that I have available to me? So just something, we kind of highlighted here, just, a couple things that were funny. We found signs around the New York metro area. Pay attention while walking. Your Facebook status can wait. That was done by the MTA. And then in case of fire, exit the building before tweeting about it. This stuff happens, but it talks to the real-time information that's actually going on. And if you think one of your employees, when something happens in your facility, isn't going to tweet about it before they leave the building and before they get the message from you, you're sorely mistaken. It's almost guaranteed to happen. They're going to find out because, they're cool. They get people to like them that way. They get people to follow them that way. People are now calling them. Their families know about it. Things like that. So those are concerns for you. I just wanted to give you an example for those of you who aren't social media folks and don't use social media a lot, or maybe don't deal with the technology piece of what you do every day. This is a snapshot from our command center screen from TweetDeck. So we have our own Twitter feed. That's the @Northwell CSEM in the first column. Our employees have a Twitter feed, #NorthwellLife. And then we're also happen to be monitoring the Ebola outbreak during this time period. And what you'll see our division was actually putting stuff out there about winter. And, looking at possible accumulating snowfalls, because that talks to traffic. We have some facilities that are on hills and difficult to get to with road closures. So we got information out to our employees that was important. We didn't give them specific snowfall amounts. We didn't tell them it was going to be a blizzard, it was going to be epic or anything like that. We gave them some information. And then we fed them additional information. We have our employees putting out pictures all the time. We're finding out stuff's going on from other groups and facilities that we didn't know was occurring. So it's good to have that intel because in an operation this large, we can't be connected all the time to everybody. So in the emergency management realm especially, we like to know what's going on. It's a great way to get intel of what's going on around our area. And in Ebola, we actually put up a feed and took every single Ebola tweet that was there and kind of took a quick peek at it and started looking through them to see pictures, full stories, what was being reported, because the media outlets I don't get on my Cablevision or my Verizon Fios or my DSL or whatever it is, but I'm getting live information here from scenes or other articles that I normally wouldn't have access to. So that's one of the things we definitely look at for creativity, and we leverage this piece of it a lot. One of the other things we've done from the creativity side is we built an employee blog, and during major disasters, we actually ask our employees to send in their stories. So it gives that employee continuity piece together of, hey, listen, we're all in this together. And you'll see there was a vice president and somebody else here that posted videos and pictures from their homes of the impacts of the hurricanes. So this is an important piece for us. Not to mention the fact we're now getting intel about what our employees are going through outside without talking to them, without waiting for them to come to work and tell us a story. Understanding that, hey, listen, their house is destroyed. They might not show up to work tomorrow. It was giving us that real-time data that we didn't really necessarily capture about our employees. And we can reach out to some of these people from this and say, hey, listen, you posted in the blog. Do you need any help? And that helps get buy-in from the employee at the end of the day that we are there to support them and the communications we're leveraging are good for them. These are some of the hospital use cases we're looking at in healthcare. We're looking at our emergency management buckets, active shooters, evacuation, situational awareness data. We're looking at all our hospital codes, whatever your codes might be. Can you send out your codes via mass notification system? Quieting the environment, looking at our Press Gaiety scores by limiting some of the overhead notifications. You can't limit them all, but we can probably limit some of them. We just had no other way to disseminate some of this data. The other information we got in reference to this was during hospital codes, our leadership teams are often not in our facilities. They're out at a meeting, they're on an off-site, they're someplace else on the campus and don't hear the overhead. How else do we message them? How do they get that notification? We leverage mass notification for that. Our quality teams are looking at them for equipment recalls, on-call teams, support services, human resources. We're really running the gauntlet of how we're using our systems here because it's important to our employees getting notifications. We didn't want to sell them short after some of our after-action points and make sure they got the information they needed for an incident or an event or something that's occurring around their facility. The bidirectional apps, like I talked about, you have some chat ones, you have some mobile panic stuff, some mobile warning stuff that's out there. Some of these are paid, some of them aren't. One of the ones we like to use locally is FireChat. The reason we like to use this, and it's been in some articles as well, it works off of Bluetooth. It doesn't work off of Wi-Fi. So it's phone-to-phone direct messaging, so you don't need a network for it. And because it's Bluetooth, it's encrypted. So you can send encrypted data from phone to phone. You can't really pick it up. Mobile panic. There's a lot of sites looking at panic alarms and sites with Amber Alerts and mobile arrest systems for their employees. When you look at some of this stuff, can I take it outside the hospital? Can I extend the services of panic in my hospital to an employee out in the street, whether they're on duty or not, to get them services and help? Can we look at stuff like that? Is it a consideration for your site? It might be. We're exploring the ideas here of putting it in home care's hands, putting it in every employee's hands, saying you push this app, it goes to our security center here, and they'll make out and get you the help you need. So it's really supporting our employees with the communications theories. Lastly, I want to talk about dispelling the fear of information. There is a ton of information out there, and a lot of people are not happy with that fear. And the folks here, we answered that poll pretty well. Most of you weren't afraid of technology and everything like that. But what about that information? What about your bosses that are listening to this information? Do they trust the information? Or are they going to question it 1,000 times? We have to make all these kind of pitches here locally, and I can talk to my experience here, and then the folks I was talking about with FEMA, at some of my FEMA classes, was, what is that fear? What have you guys addressed? And we kind of got a lot of the same information. So let's look at smartphones for a second. For those of you who don't think people are turning to their smartphones for information, it's all right here for you from a 2015 Pew data study. And that was 2 years ago, so imagine where this is going, right? 2/3 of people own a smartphone. 90% rely on the internet for breaking news. 35% more devices than we had in 2011. 68% of people follow breaking news on their smartphone. That's pretty significant. Then 67% people share or view content about events on social media. And you can see it there, by 2019, we're looking at going from 1.25 billion to 5.6 billion smartphones in the arena. What's this mean for your entity? What's this mean for your healthcare system, your healthcare coalition, whatever it's going to be out there? How's this going to impact you? How can you leverage this to your advantage? We also asked the question, did some research on this. Are we a hooked society? We see all these pieces of information all the time. Is it hooked? Are we looking at what's out there? How many people are doing certain things? So this really talked about the amount of employees without a device for more than 1 hour in a day was 21%. Only 20% of employees are without a device for more than 1 hour in a day. So regardless if you told them they can't carry it or not, the survey says they're still carrying it. Can you think about the last time you didn't have your device, especially if you're a leadership person? Most people in healthcare leadership I've noticed carry 2 or 3 devices. We should be leveraging these for notification, leveraging the smartphone idea for notification, especially when you look at the people that are coming up in a workforce now. The next generation of our workforce is media-driven, is tablet-driven. So they are going to be hooked. They're going to be using some of this stuff. Some privacy concerns that you might tackle is Big Brother watching. We tell them only if you want us to. Any device we've looked at for this, we've given them the option to say, we don't want you to follow me, but we'll take your notifications. We give them the option to turn off that geolocation on their phone. The I don't want you to follow me theory. How do we look at that? How do we get away from that? It's a challenge for us. We've actually made it a process in our sites. As a condition of employment, you must put a mobile phone number on file with us for emergency notification. And we gave our employees tons of data on why. This is my device, I don't want your stuff on it, is the other one we run into. I want you to use this employee app, it's great for you. I don't want it as my device. Give me my own device from you, I'll take it. We really don't look at that too much. But think about some of the other privacy concerns when your employees are telling you these things. 39% of employers dig into social sites now prior to hiring an employee. 43% said they found something and didn't hire a candidate because of something on social media. On the opposite side of that, 19% of people that were evaluated on social media in this Career Builder survey actually were hired because of what was on their social media sites. So it goes both ways. But what do I want out of that? What are those privacy concerns? And those will be challenged on every aspect of what you do in your communications platforms. One of the things we have leveraged here, like I said, we care a lot about our human capital, our employees. In our experience, we had employees feel positive about using their device for emergency notification. We've reshaped that here a lot. We've asked them, they've asked for more information, we pushed to them. They want it, they're asking for it. We're looking at more ways to get them information. They like their smartphones better than corporate email for communications. That's important to them because they have to log in to get to their corporate email, but their smartphone, they can get text messages and app messages from us with no problem. They were more likely to come to work and remain at work during a disaster because of the information we were providing them. We've had better than expected attendance during our disasters. What you're actually seeing here is a screenshot of one of the messages we sent out post-Sandy to several of our employees. As a valued member of the Northwell team, we were in Northwell IJ at the time, we would ask employees that need assistance, please choose one of the following options. And some of these systems that are out there will actually let you take the poll result and query them and re-message people and everything else with them to be able to bolster your employee resilience programs and things like that and help your employees during times of need. So employee response is definitely key and has to drive your program. If we were getting crap response, we'd have to look at how we were doing this again. But we've gotten some pretty positive response in our experience here. We've looked at this stuff. So like I said, the three things you really want to consider: situational awareness, creativity, and the fear of dispelling the information. The information out there can be utilized. There are creative ways to do this that aren't going to break the bank. And situational awareness, the same thing. You can look at not breaking the bank with your situational awareness programs and taking that information in. It's important to look at all those sources that are out there for you. My contact information is here if you want to contact me directly. I'm sure there might be one or two questions from the audience through Lisa. That's fine. You can reach out to the Everbridge folks if you have any more information. That's absolutely fine. I can answer some questions now. I left a couple minutes for it. I hope I enlightened some people into how you can better leverage your communications theories and platforms in healthcare and how you can actually get to that creative point where you're dispelling the fear of information.
Before we get into the questions, I want to do just a quick overview of Everbridge. So one of the questions that did come in was they asked what notification system that you do use, Joe, and we are happy to report that you use Everbridge among your suite of communication tools. And we do cover every aspect of hospitals and healthcare systems. So from clinical information running through the emergency department and even among patient floors, we handle IT services. If your EMR crashes, we have a system so that you can find out right away. Emergency preparedness, which is all about today's presentation and all the different ways that you do need to talk to your people in the community. And then any of our clinical information on our Everbridge app, yes, we have apps too, is HIPAA secure so that your clinical staff does not need to worry about some of those breaches that have been happening lately and some of the fines that have been coming down. We do believe that good communication is good medicine, so we hope that you agree. With that, I'm going to just start going into some of the questions. Kevin asked an excellent question. What % of the people say that this is my device and I don't want your stuff on it? So how much resistance do you get with cell phones?
We've had some big challenges with this. I couldn't give an exact percentage. I'd say 1 out of every 20 people in a meeting usually will say, I don't want your stuff on my phone, and that's just a local kind of theory here. Part of the problem we're having with this is, people are coming up with an excuse not to have it, so we've had to reframe how we package it, like I said, and tell them we're trying to help you more than we want to track you or anything like that. We also give them the option. If you don't want to download an app, you can get text messages. People have to pay for text message plans. Apps are usually free in our Wi-Fi network. There's no one answer to that. I'd love to actually see if there's a study out there, or maybe myself and Everbridge can get together and do our own study in healthcare about how many people don't want their stuff on our devices, and we can look into it further. Thank you, Kevin.
We can definitely follow up on that study, Joe. It would be good for all of us to know. This question coming in from Jason is, do you use plain language overhead announcements for active shooter events at your hospital?
We do use some plain language stuff. We do have a code for it, but usually after the code they will repeat what's happening. It's being evaluated now. We're doing lots of drills and reviewing all the after-action reports to decide what the best format for this is. We've obviously looked at both sides where if you just do the code, your visitors don't know what it is. And if you just do, if you do overhead, your visitors know what's going on. The concern we look at is the code actually works a little bit better from what I've seen because it has my employees now engage the visitor and tell them what to do rather than the visitor panicking and running out the door, causing some trampling thing. Or we're teaching our people run, hide, fight, and things like that, but we're not teaching the public run, hide, fight. So by giving them the information, we're actually causing more of an issue with our visitors. So we're trying to stick to the code. We're actually looking at it both ways.
And then I have a question. It sort of came up when you were talking about Hurricane Sandy, but it's something that we saw recently with Hurricane Matthew. Everbridge had over 900 entities using our messaging system during the hurricane, everything from local government to hospitals to even private corporations. And one of the things that we saw was very long messages to the point where it was becoming ineffective because there was so much information. Do you have a rule of thumb that you follow for an effective length, enough information but not too much?
We've actually been living since we did start using, the Everbridge product, and we actually took some of your information. You guys were well verified in that. We kind of stick to your 3-3-30 rule. It works out pretty well. we've actually found that less is more or less more. Our employees don't listen. People don't read fully. They forget what we told them. So try to keep it short and often rather than long and few and far between. And that's kind of how we're looking to leverage that data, is get them messages in a timely fashion more often than not with less information in them, and then steer them to someplace else if they want additional information, rather than sending them a long-winded message and never following up.
Great, thank you very much. And then we have one more. What I am going to say is there was a couple of very specific questions that came in, and I would love you to email me, lisa.johnson@everbridge.com, and I can follow up with you specifically to get you the answer that you need. This one is a little bit more general. It is, how actively do you monitor social media during an incident? And is it to the point where you have a dedicated resource, or is it something where you're on the fly checking as you can?
So one of the things I didn't really mention earlier in the presentation is the investment in emergency management at Northwell is dramatic. We have a full-time staff of 6 emergency management coordinators for our system, plus each of our sites has their own. Part of that is we actually have a Northwell-wide command center that's open 24/7, 365, with a really nice video wall, and we keep a Twitter feed up on that 24/7, 365, with more or less a dedicated resource to it. We have that availability. But one of the things we tried to do when we designed our command structure in our command center was make it completely mobile. So when the emergency management coordinators leave, or there's a transition shift or something's happening, they can take it with them. They can look at it on their phone, their iPad, their laptop, and that's how we really use it. And most of the guys are looking at it almost real time, daily for events.
All right, so thank you everyone very much again. If you do have any specific questions from the webinar and you'd like us to address it, I can pass them along to Joe, or it might be something that we can answer as well. It is lisa.johnson@everbridge.com. Joe, on behalf of Everbridge and everyone here, thank you so much for today's presentation. I saw a lot of comments go by about how in-depth the information was. It's really appreciated.
You're welcome. Thank you for having me.
And we will see everyone soon. We do offer webinars on a regular basis. We do very much try to get content that is as good and strong as Joe's, stuff that you can use right away in your job in your healthcare facility. Thank you very much.